of guests on the anniversary of smallpox eradication. We had to change this for different reasons, and I'm sure Dr. Tedros will mention this event and this anniversary in his opening remarks. So I will give the floor to Dr. Tedros.
Thank you, Tariq. Good morning, good afternoon, and good evening. Exactly 40 years ago today, on the 8th of May 1980, the World Health Assembly officially declared that the world and all its peoples have won freedom from smallpox. Smallpox is the first and to date the only human disease to be eradicated globally. Until it was wiped out, smallpox had plagued humanity for at least 3,000 years, killing 300 million people in the 20th century alone. Its eradication stands as the greatest public health triumph in history. As the world confronts the COVID-19 pandemic, humanity's victory over smallpox is a reminder of what's possible when nations come together to fight a common health threat. Many of the basic public health tools that were used successfully then are the same tools that have been used to respond to Ebola and to COVID. Disease surveillance, case finding, contact tracing, and mass communication campaigns to inform affected populations. The smallpox eradication campaign had one crucial tool that we don't have for COVID-19 yet: a vaccine. In fact, the world's first vaccine. As you know, WHO is now working with many partners to accelerate the development of a vaccine for COVID-19, which will be an essential tool for controlling transmission of the virus. But although a vaccine was crucial for ending smallpox, it was not enough on its own. After all, the vaccine was first developed by Edward Jenner in 1796. It took another 184 years for smallpox to be eradicated. The decisive factor in the victory over smallpox was global solidarity. At the height of the Cold War, the Soviet Union and the United States of America joined forces to conquer a common enemy. They recognize that viruses do not respect nations or ideologies. That same solidarity built on national unity is needed now more than ever to defeat COVID-19. Stories like the eradication of smallpox have incredible power to inspire. But there are many more untold stories about health around the world. Next Tuesday, the 12th of May, WHO will announce the 5 winners of our inaugural Health for All Film Festival. The winning films were chosen by a distinguished panel of jurors from almost 1,300 entries from 110 countries. The shortlisted films can be seen on WHO's YouTube channel, and we invite everyone to join us on our social media channels next Tuesday for the announcement of the winners. Yesterday, I announced the resources WHO estimates it needs to deliver our updated strategic preparedness and response plan for COVID-19. The updated plan estimates that WHO requires $1.7 billion to respond to COVID-19 across the 3 levels of the organization between now and the end of 2020. This estimate includes the funds that WHO has already received to date, leaving WHO's COVID-19 response with a funding gap of $1.3 billion for 2020. To be clear, this estimate only covers WHO's needs, not the entire global need. WHO is deeply grateful to the countries and donors who responded to WHO's initial strategic preparedness and response plan, and to the hundreds of thousands of individuals, corporations, and foundations who have contributed to the COVID-19 Solidarity Response Fund. And we thank you so much for your commitment and support. Our updated strategic plan takes into account the lessons we have learned so far, strengthening WHO's role in global and regional coordination. It's built on 5 strategic objectives. First, to mobilize all sectors and communities. Second, to control sporadic cases and clusters by rapidly finding and isolating all cases. Third, to suppress community transmission through infection prevention and control and physical distancing. Fourth, to reduce mortality through appropriate care. And fifth, to develop safe and effective vaccines and therapeutics. To support these objectives, WHO will continue to provide technical, operational, and logistic support to countries, and we will continue to update and adapt our guidance according to local needs. In certain fragile settings and countries with weaker health systems, WHO will continue its operational work as a provider of essential health services. As we reflect today on the eradication of smallpox, we're reminded of what is possible when nations come together to confront a common foe, to confront a common enemy. The legacy of smallpox was not only the eradication of one disease, it was the demonstration that when the world unites, anything is possible. If there is a will, there is a way. It gave us the confidence to pursue the eradication of other diseases like polio and guinea worm. Like smallpox, COVID-19 is a defining challenge for public health. Like smallpox, it's a test of global solidarity. Like smallpox, COVID-19 is giving us an opportunity not only to fight a single disease, but to change the trajectory of global health and to build a healthier, safer, fairer world for everyone. To achieve universal health coverage, to achieve our dream from the establishment of WHO in 1940s, health for all. And I thank you. But before we move on to questions, Tariq, I would like to mention one small way we are commemorating the eradication of smallpox. When WHO's smallpox eradication campaign was launched in 1967, one of the ways countries raised awareness about smallpox was through postage stamps, when social media, Twitter, Facebook, was not even in the horizon. To commemorate the 40th anniversary of smallpox eradication, the United Nations Postal Administration and WHO are releasing a commemorative postage stamp to recognize global solidarity in fighting smallpox. I especially want to thank my friend, Mr. Atul Khare, United Nations Under-Secretary General for Operational Support, for making this commemorative stamp possible. Thank you again, Tariq, and back to you.
Thank you very much, Dr. Tedros, for these opening remarks on this very remarkable anniversary day. I forgot to introduce.
Or in any shape or form, and they do not say that smoking is protective. We do know, I will repeat, that we know the harms of smoking, and we know that smokers, if they do get infected with COVID-19, have a higher risk of severe disease and death.
Thank you very much, Dr. Van Kerkhove. Next question comes from Guatemala, Diario de la Hora, and we have Grecia on phone. Grecia, if you could just unmute yourself. Hello?
Sí, buenos días.
Hello, good afternoon. My question is...
Managed to do incredible contact tracing in the middle of a very intense community outbreak. So it is possible to do, but it requires a very coherent, very well reasoned community to maintain physical distance and appropriate measures, if not a total lockdown. With the case of the Russia, I think Russia is just in a different phase of the pandemic and can learn some of the lessons that have been learned at great cost in Asia, in North America and in Western Europe.
Thank you, Dr. Ryan. Next question coming from Maya Plans from The Shift. Maya, you need to unmute yourself, please.
Yes, thank you very much for taking my question. My question is still regarding the cardiovascular issues that have been reported. If you could elaborate a bit more on how are you looking at these issues of, patients report, how does the WHO reports on this and collects data on this because I heard that some people came to hospitals not with respiratory problems, with cardiovascular problems, and then they went back home and later they were found out that that was part of the symptoms that they exhibited by being, having cardiovascular issues.
So thank you for the question. It's a really important question. As we learn, as Mike has just said, as we learn more and more about this virus, I have to remind myself that we're in month 5 of this pandemic. And although it has seemed like an incredibly long time, we're at the very, very early stages of our understanding of how this virus affects the body, how disease progresses, what diseases that this infection causes. We have a global clinical network that we've brought together. We bring this same group of clinicians across the globe together for other diseases. We activated this group very early in January to bring together clinicians who have experience with treating COVID-19 patients. And the value in doing that is you're putting clinicians talking to clinicians with firsthand experience of what they are actually seeing in terms of the patients, in terms of what those patients are dealing with, and what those doctors and nurses and medical professionals are doing to try to save their lives and to try to prevent them from progressing to severe disease. The way in which we gather information about symptoms or disease is through a standardized set of data that needs to be collected from patients. It's very difficult to collect a standardized set of data from patients when you're in the middle of a very intense outbreak and you're just trying to save as many lives as you can. But in some countries, and in many countries that don't see intense transmission right now, and especially in the beginning, what we did is we set up a clinical case report form, which is something that was developed with WHO and ISARIC, which is the International Severe Acute Respiratory Infection Consortium, and many partners, many clinicians and nurses and medical practitioners across the globe to set up a case report form that collected a set amount of data from each patient. And in doing so, that helps us gather information so that we can analyze it and say, is this common? Is that not common? Is it associated with COVID-19 infection? What does the presence of smoking or an underlying condition have to make that condition worse? So we set up this case report form. It is being used now. It took some time to get going, and there's more than 10,000 case records in this. And we are hoping that more and more case records can be obtained so that we could better understand this. In addition, we're working with a number of countries who are conducting their own studies in their hospitals. Some of these are coming out through peer-reviewed publications, but those are done by individual hospitals. And that information is really critical.
Arabi Al-Hadath, we have online Doha El-Zuhairi. Can you please